Not recommended for treating cellulite. Cryolipolysis. This treatment freezes unwanted fat to get rid of it. Bottom line, while it can be very effective for getting rid of small pockets of unwanted fat, it currently cannot get rid of cellulite. Mesotherapy. A series of injections in the areas with cellulite. Different substances are injected into the area, including caffeine, hormones, enzymes, and herbal extracts. Because each practitioner uses a unique blend of ingredients, there's no way to know what, if any, ingredients are effective. Supplements. Some people say that taking supplements that contain ingredients like caffeine, grape seed extract, or ginkgo biloba can reduce cellulite. Bottom line, there is no evidence that any supplement can reduce cellulite. Injectable treatments. There are two types of injectable treatments: injectable biologics and injectable fillers. The injectable biologic, collagenase from C. histolyticum. The injectable fillers, calcium hydroxylapatite and poly-L-lactic acid. Injectable biologics. Collagenase selectively hydrolyzes the triple helical region of collagen and is FDA approved for the treatment of collagen-associated disorders. Collagenase Clostridium histolyticum, CCH, can act on subdermal collagen found in the fibrous septa involved in the development of cellulite. CCH, administered subcutaneously in 3 treatment sessions approximately 21 days apart, significantly improved cellulite appearance in females with moderate to severe cellulite. Improvement was durable through 2 years of follow-up. In 2020, the FDA approved a CCH preparation, Quo Endoaesthetics LLC, Malvern, Pennsylvania, for the treatment of moderate to severe cellulite of the buttocks in adult females. However, on December 6, 2022, the manufacturer announced the termination of the production and sale of Quo due to concerns about the extent and variability of bruising following initial treatment as well as the potential for prolonged skin discoloration. Injectable fillers. Calcium hydroxylapatite, CHA, Radies, MERS North America Incorporated, Raleigh, North Carolina, is currently approved as a volumizing agent. Diluted CHA induces neocollagenesis and elastogenesis, which can lead to increased dermal thickness, skin elasticity, and pliability. Based on these beneficial skin effects, diluted CAHA has been used as a treatment for cellulite. Poly-L-lactic acid, PLLA, Sculptra, Galderma Laboratories, LP, Fort Worth, Texas, is an injectable volumizer. It is FDA approved for the correction of shallow to deep nasolabial fold contour deficiencies and other facial wrinkles. PLLA is also a biostimulator that stimulates neocollagenesis, leading to skin tightening. PLLA treatments, 3 treatments every 4 weeks, in combination with subcision, have been shown to significantly improve cellulite severity. Cellulite is a clinical state stirring up a lot of controversy. There is explicitly no effective method of getting rid of this disease. Multiple therapeutic approaches are available, but many only ameliorate cellulite appearance or reduce its severity. Treatments that target the fibrous septa appear to produce more significant improvement that is more durable. Further elucidation of the etiopathogenesis and pathophysiology of cellulite is needed to produce more targeted therapies in the future. For the present, a treatment strategy that utilizes a combination of modalities targeting the multiple etiologies of cellulite might produce the best results. Frequently asked questions. What is the difference between cellulite and lipedema? Lipedema is a medical condition that causes excess fat to accumulate in the lower part of the body. Lipedema most often involves the buttocks, thighs, and calves. The upper arms are sometimes affected. It doesn't affect the hands or feet. Lipedema causes your skin to become sensitive, may hurt, swell, feel cold or bruise easily. As lipedema gets worse, it can affect your ability to walk. Cellulite is a cosmetic condition. It also most often involves the stomach, buttocks, and thighs, and it also looks like cottage cheese, oatmeal, or an orange peel. Cellulite may look embarrassing, but it isn't painful. Cellulite doesn't affect overall physical health, and it doesn't hurt. However, you may not like how it looks and wish to hide it. What is the main cause of cellulite? The main cause of cellulite is not exactly known. Cellulite forms when fibrous bands connecting your skin to the underlying muscle tighten irregularly. This tightening pulls down on your skin, and the normal layer of fat beneath the skin pushes upward. The result is a puckering appearance to the skin. It's also not known why cellulite is more common in women than men. One theory involves the bands connecting the skin, hypodermis, subcutaneous tissue, and deep muscle layers. In men, the fibers that make up the connective bands crisscross together. In women, the fibers that make up the connective bands run the same direction and are an equal distance apart, parallel. Parallel bands may show puckering better than crisscross bands. Another theory is that higher amounts of the hormone estrogen may cause cellulite. Cellulite often develops when women produce more estrogen, usually during adolescence or pregnancy. Is cellulite contagious? Cellulite isn't contagious. You can't spread cellulite through skin-to-skin contact. Is it possible to get rid of cellulite? People of all body shapes have cellulite. It's natural, but it looks puckered or dimpled because of the way that fat pushes against the connective tissue. You can't completely get rid of it, but there are ways to improve its appearance. What can't I eat if I have cellulite? You can eat what you like if you have cellulite, but bad eating habits increase your risk of developing cellulite. A high-calorie diet that features a lot of carbohydrates, fats, preservatives, and salt may contribute to the development of more cellulite. How soon after treatment will I start to see results? It's important to remember that your body is unique. Your results will depend on what treatments you and your healthcare provider decide are best. For example, acoustic wave therapy may require 6 weeks of treatment, and the results may last for 2 to 6 months. Subcision treatment may yield results as soon as 1 month after the first treatment. Retinol creams require at least 6 months of use before you see noticeable results. Exercise may take at least 2 to 3 months. How can I reduce my risk? You can't do anything that guarantees you won't get cellulite. But there are some steps you can take to help reduce your risk, including avoiding processed foods that are high in carbohydrates, fats, preservatives, and salt. Taking supplements that contain caffeine, grapeseed extract, or ginkgo biloba. Exercising regularly. What can I expect if I have cellulite? You can't get rid of cellulite. But, it's not harmful to your overall health. You can reduce the appearance of cellulite through a combination of exercise, diet, and treatments. The bottom line. Cellulite is a common skin condition that affects everyone. However, women who have gone through puberty are far more likely to develop cellulite. Despite how common it is, you may not like how cellulite looks on your body. Healthcare provider can help you to reduce the appearance of cellulite. Together, you can decide what treatment is best for you. Cellulite differs from fat. Treatment that can effectively remove fat often has no effect on cellulite. Liposuction and dieting do not remove cellulite because it does not affect the structure of the connective tissue.